everyone. I'm Stacy Geringer, the Associate Director of Outreach at the Center for Advanced Studies in Child Welfare, also known as CASHU. We're a research and training center at the School of Social Work at the University of Minnesota, and we partner with faculty within the school and across the university to translate research to child welfare practice. Thanks so much for joining us today. We're glad you're here. We're super excited to welcome you all to this webinar where we invite Dr. Seema Samimi to explore school seclusion, partnering to support children and families, and share how child welfare workers can play a role in situations where seclusion occurs, with a real emphasis on supporting children and families in understanding their rights, experiences, and options. So we're going to get started here in a minute. I'm just going to go over some housekeeping. This webinar is being recorded. Please use the Q&A during the presentation, and we'll monitor throughout the presentation, and we'll also save a little bit of time at the end. To ensure that closed captioning is enabled, please click the Show Captions or CC Live Transcript button on your meeting controls toolbar, or find it under More if it's hidden. There will be an evaluation survey at the end of the webinar that will pop up via Zoom. And then we'll also be sending a post survey to complement that pre-survey that you all received. CEUs will be sent via email from the Cashew account following this webinar to those who attend the entire session. And then we'll share the presenter contact information and resources in the chat as well as in a follow-up email. We'll also provide you the slides. If you need any accommodations during this webinar, please chat directly with the host and we'll be happy to help you out. And then you can contact us via email with questions as well. So I'm going to pass it over again. Welcome, Dr. Samimi. We're so happy to have you.
Hi, thank you very much. So, like Stacy said, I'm Seema and I'm a faculty member at School of Social Work. So today we're going to be talking about seclusion and just a quick intro of like why is, school seclusion really sits at the intersection of child safety, disability, trauma, and family engagement. And child welfare workers can definitely play a role in how seclusion happens and why and when. So that's part of the reason why I wanted to speak about this today. And also, it's really important to understand the evidence and research around school seclusion, as well as the educational and policy aspect, which there's a big lack of understanding among people in general. So, hoping to clarify some things. So, what we're going to learn today is to talk about the terminology around all of these issues with seclusion and restrictive procedures and different things in special education in Minnesota, identify the impacts of school seclusion, and also talk about practical advocacy strategies. So hopefully you'll leave with all of those things. So first we're going to talk about some of the terminologies, and policies that are important to know. And restrictive procedures is a term that is used by the United States Department of Education and by the Minnesota State Department of Education. And I'm not going to read this entire slide, but it's important to know that restrictive procedures includes restraints and seclusions. And when we're talking about restraint, we're talking about something that immobilizes or reduces the ability of a student to move. Um, Minnesota defines it a little differently. So we're going to get into all of that. But usually a restraint is some sort of physical hold or way of touching the students. Mechanical hold is where you would use an item like handcuffs or zip ties or something like that. Mechanical restraint. So mostly we're talking about physical restraint today. And then seclusion is when a student is alone in a room, or this is the federal definition, an area from which the student is physically prevented from leaving. So we'll get more into that, but they have to be alone and they cannot leave in a room or area. So the Department of Education in Minnesota, we can go a couple slides forward. Yeah, thank you. Um, discusses restrictive procedures and talks about restrictive procedures as both physical holding or seclusion of children with disabilities, specifically children with disabilities. And it has to be in an emergency. Um, and there's some definitions here of what emergency means. Uh, and really, we're talking about, is it a severe situation where there will be injury if it doesn't happen? Um, and seclusion in Minnesota is a situation in which a child is confined alone in a room and prevented from leaving. So a little bit different than the federal definition. And also, a couple other things to mention is prone restraints, which was, it used to, well, it still is, but it's a type of hold where a child was laid face down on the ground and the adult would be on top of them. That has been banned in Minnesota. So that is not the kind of hold we're talking about. A physical hold, as it says here, it's intended to hold a child immobile, and they mean literally holding with your arms as an adult. Um, okay, so I would also say that it used to be the law and the law that changed the prone restraint uh, was because it meant what it says is school employees and school resource officers cannot physically restrain students in a way that impacts their ability to breathe or voice distress. Okay, so um, now this is the actual state statute. So in the law. Seclusion means confining a child alone in a room, which we saw in the Department of Education definition, where egress is banned or barred, sorry, and you can lock the door, but it just means preventing a child from leaving. If everyone leaves the room and the child is still in a room, that is not considered seclusion. Okay, sending a child to a room where they can't participate in class is not considered seclusion unless they're in a room alone where they cannot leave. Okay, so that's an important thing to understand. A lot of confusion happens because people aren't aware of seclusion being a legal term that is in the state statute as well as education policy. And there is often a misunderstanding that seclusion means going to like the cool off room or the wellness room or a room that is, designed to help a child calm down and maybe has like soft lighting or some fidgets and things like that. That is not seclusion by law. That is, um, especially if the child can leave, but actually other parts of law say there can be nothing else in the room. So we'll get to that. Okay, so what I have found in my research, so I did focus groups with educators, and after the focus groups, I talked to other educators and other people, and they agreed that this is pretty common, is that people who work in schools often refer to restrictive procedures to only mean holds, physical holds. So they'll say, oh, I mean, when I was talking to them, they would say, I had to put the child in a restrictive procedure and then we also had to use a seclusion. So oftentimes, just I guess the convention is to say restricted procedure instead of hold with educators. And as I was just saying, there's a lot of different ways that people understand seclusion. And although there is a definition in policy, educators have talked to me about students being placed in a room or area that maybe doesn't have walls that go up to the ceiling, or like maybe half walls, or has three walls and no door, or everyone evacuating a classroom and leaving the student in the classroom with an adult or without an adult. or students saying, hey, can I go sit in the seclusion room? I want to be alone for a little while. And while in practice, people who work in schools may understand all of those things to count as secluding a child, in law and policy, it does not. So just want to make that really clear. Okay, hang on, I'm gonna get a drink of water. Okay, so some things about seclusion in Minnesota. I believe, well, it can only be used with children who are, quote, in special education. And we'll talk what that means about what that means in a minute. It is for emergency use only. So there's different ways that this is interpreted. I think this is from that same statute where it says immediate action is needed to protect a child or an adult from physical industry injury. Um, Both MDE and the state specify that seclusion is not to be used for school discipline. And I think sometimes people get confused about seclusion as a discipline strategy versus a emergency intervention, where it is not to be used for any, I guess, activity or behavior that would not cause immediate or harm to a child or an adult. And if it is being used for that, then that is actually discipline and not an emergency intervention. Okay. In Minnesota right now, it's not to be used for students in third grade and below. Um, and it is perfectly, there's no policy or law that says it cannot be used with, what I'm trying to say. Parents don't have to give permission or know what seclusion is even. It can happen to a student uh, without a parent knowing in advance that that is a thing that could happen. And I will also say that even though the policy says and the law says that it's not to be used for students in third grade and below, the data that MDE has shared shows that there are students who are in pre-K who have been secluded. Now, we'll talk about that in a minute. There's also students who are not in special education. So even though the law says this, that does not mean that it doesn't happen with other populations or groups of students. And in all of those cases, there's no requirement to alert parents in advance that this could happen. Um, if it's not in a student's IEP and they are secluded twice in a 30-day period, then there has to be a meeting held to talk about the what to do with and how to respond. Um, I would also mention here, like parents do have to be notified when a seclusion happens the same day. And restrictive procedures have to be used and can only be used by a licensed professional or a licensed personnel. So it could be a teacher, a social worker, or a school psychologist, something like that. And they have to be trained. And this is both for holds and seclusion. And this is state law. And uh, what else? The other thing is that seclusion, while it does happen more in schools that focus on students with higher special education settings, so if you're familiar with setting one, two, three, and four, more often in setting three and setting four schools, it does happen in all levels of schools. Okay, where's my, hmm, sorry, second. So this is just every district has to have a restrictive procedures plan. And this is per MDE as well as federal law. And so the plan here is I just put a screenshot. This is actually a example fake one that MDE provides to schools as a template. So it might not necessarily look like this, but it's supposed to be available publicly. So if you work in a specific district or have a client you're working with who might be secluded for different reasons, I would advise that you look on that client's school's website to see, or this district's website, one or the other, to see what the restrictive procedures plans say, and make sure you're familiar with those policies. Okay. Um, so a lot of people, like I said, aren't don't know or aren't familiar with what a seclusion room looks like. And last fall, I think, um, Legal Aid, the Minnesota Disability Law Center, did a report. So they are the federal oversight organization for school seclusion in Minnesota. Every state has an organization that does the kind of auditing and regulation reporting of seclusion rooms. And so they did an audit and went to many, I don't know if they did all of them, many of the seclusion rooms in the state, and they made available videos on YouTube of what these rooms look like. So I just have one here, and this is one that was in compliance with the standards and the laws, and they found to be like appropriate. So just so everyone has an idea of what they look like. They're not always padded, and there's no rule that says they have to have padding. There's no rule that says that they have to have a drain in the floor, although that is for you can imagine why. Um, and it does say that there needs to be a window. So there's a window in the door of this one. But can you play it again? You can also observe here, there's no doorknob on the inside. So there's no way for somebody to leave the room. And I believe there's a camera in the ceiling. So I'm assuming that is so the student can be observed. But th there's somebody looking in, and ideally there's someone monitoring the whole time there's a student inside. So that's what a good seclusion room or appropriate seclusion room looks like. Just wanted to share that. Okay,
Hey,
so
Seema, sorry to
mhm.
interrupt, but there is a question from Heidi that we
Yep,
might want to visit just because it has to do with a slide we were previously on.
sure, yep. Sorry, I gotta
Oops,
navigate.
I can help too. Can you see it?
No.
Okay, so Heidi's wondering about some conflicting information on the last slide. So prior to the video, how often can children be in special education and not have an IEP?
Um, I'm not sure what's conflicting. Which slide was it?
I think it is this slide possibly, and then probably this slide is what Heidi's referring to. And
Well, this is a good question because it is a little bit confusing. And it took me a while to figure out myself what this meant. And what from reading the policies, what and it doesn't actually say. It doesn't actually define special education or in special education. But looking at the data that MDE reports, they report on students who have an IEP, and they report on students who have 504 plans. So we're going to get to a little bit about what the differences are in those two things. But my understanding is that if we're defining or saying only students in special education can experience or be put in seclusion, then it's any student with an IEP or a 504 plan on record who is also above third grade because we also have that limitation. So I hope that answers that question. Um, but it's not clear in the policy. If that's just my conclusion after reading the policies and looking at the data. But I've asked that question is like, how is special education defined? And that actually hasn't been answered yet. but I'm working on it. Um, yeah. Is there any follow-up to that?
I think that's good for now, Seema.
Okay, so we're actually going to have about that right now. So 504 plans, IEPs and IFSPs. So, any of if a student has any of these on record, then they could be considered to be in special education. And I'll be honest, I grabbed this graphic off the internet. It was one that I liked. There are many, but it kind of I just the it's not really important what it says as much as the idea that they overlap. IEPs and 504s both have a goal of ensuring students have the accommodations they need to fully participate in their education, right? The IDEA Act um, it outlines IEPs and what is required of them. And the 504 plan comes from the 504, or I guess Section 504 of the Rehabilitation Act of 1973. So, if a student doesn't require specialized instruction, generally they'll have a 504 plan. And that could be if a student has severe allergies, for example, and they need an accommodation to eat lunch away from other students or something like that, or away from the lunchroom. It could be a variety of things. It could be ADHD. It could be anything that modifies their learning environment that doesn't require specialized instruction. And it's a civil rights law. Okay. And IEP, however, is, like I said, part of IDEA, which I can't remember right now what it stands for, but that has 13 specified conditions or disabilities, and they are said to have an adverse impact on a student's ability to learn. So IEPs are different in that they include things like goals that are measurable for function as well as academics, different services a student will receive, and they'll talk about the least restrictive environment that a student can be placed in. So it's developed with the parent and a team of people, usually who are school faculty. Other people might be invited. When I was working in child welfare, I was often invited to IEP meetings, as well as a child's doctor might be invited, or therapists outside of the school, or all sorts of different people. Um, and it's regularly reviewed and updated at least once a year. Um, so those are kind of the differences. An IFSP is similar to an IEP, except it's for students who are in um, I want to say kindergarten and below, but it might be pre-K. I can't remember. I'm sorry. But it's just for younger students. And it's the F just means instead of, IEP is individual education plan and IFSP is individual family services plan. So it's more talking about the services for the entire family. Um, so that's what those are. And are all ways to be classified as in special education. And we'll get a little more into this. I'm not going to read all of this text, but the thing that I want folks to remember is that medical diagnosis and a diagnosis for special education, the idea that you have a disability, um, is different. So schools can give you a diagnosis that you don't necessarily need to have from a medical provider or a psychologist, and vice versa. So just to make it a little more complicated, so let's say you get a diagnosis from your uh, psychologist, or your child psychologist gives them a diagnosis of a disability, but that disability diagnosis doesn't get reported to the school, or is not something that is noticed or calls attention in a way that would create a need for intervention by educators, then it is possible for a student to have a diagnosis that would qualify them to be in special education, but to not have an IEP or a 504. Okay. So I've heard that this often happens with ADHD, where they learn strategies outside of school to manage it. Maybe it's medication or other things. And so they don't even want their school involved or no, need to know, for example. But it could be other diagnoses or disabilities as well. So it's important to remember that disability is a social construct, right? And the definition of disability is going to change and vary across different schools, families, and health systems, because uh, each has a different perspective, right? And schools are going to prioritize educational impact. Families are going to probably look at daily life and how a student or a child can manage their day-to-day activities. And health systems are going to look at health and mental health. And so there can be a lot of confusion or gaps in support because of the different constructs of what disability is and what each kind of disability means for that student. And of course, the student themselves might have their own way of seeing their disability. So it's important to try to align these perspectives as much as possible so the child can receive the resources they need in education. And schools will use things like IQ tests or reading screens and follow education laws, where health systems will follow medical guidance and, like from the DSM or the ICD-11. And this chart, I actually, in the resources, I have included the entire guide that this is from, but this is decision tree for the diagnosis of emotional disturbance. And on the left, there's the criteria for the IDEA Act. So this kind of diagnosis could be conducted by teachers, either in general or special education, a school psychologist, school counselor, administrators, right? And parents or others could also share observations. And then they would meet most likely and go through the decision tree and say, okay, which of these things can we say probably is represented in this student? And then we will diagnose them with emotional disturbance. On the right is the emotional disturbance decision tree that is used by medical or mental health professionals. And that is also completed or also involves many people, but it's different in that different the different people who are involved all conduct the assessment in a way. So teachers and educators will, there's a teacher form that goes with the EDDT uh, decision tree. Um, so they'll complete the teacher's form. Parents and guardians have to complete, or I think they don't have to, but should complete a parent form to talk about their perspectives from home life. And other school staff can also complete forms or do ratings of the student and what they've observed in them. And psychologists, therapists, all these people do their own assessment, and then that gets reviewed by the medical professional, usually a psychologist, and then that medical professional will make a decision about what it looks like for that student. And so I hope this makes sense. But the idea is, some students have both uh, medical and school diagnosis, but many students do not, and they'll have one or the other. And this is important for a lot of reasons, one of them being services and referrals and insurance. So, as you can imagine, if we had a student, let's say, who had a school IDEA Act diagnosis of emotional disturbance, but did not have the medical diagnoses, let's say they experienced seclusion, their behaviors are very activated and you know, they need additional services and therapy, and the school wants to refer them to for that, but they don't have a medical diagnosis. It's going to be difficult to find somewhere who can service that student without, because they won't be able to get paid without the diagnosis. So, if you encounter students who don't have the medical diagnosis but do have the school diagnosis, it might be worth talking to the family about and the student about pursuing that and how that could happen and helping them through that process because that will help with, additional services outside of the school setting. Okay, any questions about that part?
Seema, there is just one question that I can read to you. Are
Okay.
children being evaluated for an IEP considered to be SPED, or do you have to wait until the IEP is signed slash 504 plan is active? I can put it in the chat. So are they considered to be special education, or do you have to
Yeah.
wait?
Um, my practice experience is not in Minnesota. It was in New York. And in New York, so I can only speak to that. And I should have tried to find an answer to this question beforehand. It's a good question. In New York, you were not considered to be in special education until that IEP was complete. And I'm pretty sure it would be the same here because the school district, I mean, when it comes down to money, right? And the school district isn't going to pay for services or for a student to be in a specialized classroom unless there's some sort of documentation saying it's needed, right? And that it's required, which would be the IEP or 504 plan. So my assumption would be no, they're not considered to be until it's complete, but I would double check that with someone who works in schools specifically. And I can actually, I will double check that for you. And we can send that out. Yeah, it's a
Well,
good
one of
question.
one of our attendees, Robert, said it's the same here. Can't
Okay.
start services until initial plan is signed.
Yeah. Yeah, and the other reason I would assume for that is because the child, depending on the child, their age and level of understanding and whatnot, but also the family has to agree to those services and that those are the appropriate services. So you don't want to start services that maybe aren't the appropriate ones or aren't the things that a family thinks would be appropriate or would want their child to be in. So that would be another reason, I think. Yeah. Thank you, Robert. Any other questions?
Nope.
Okay. All right. So now we're going to talk a little bit about what do we actually know about seclusion. And I can tell you it's not a lot, but we're going to get into what I've been able to figure out. Okay. So reason seclusion is used. So, we have the legal reason, which is someone's going to get hurt, and so we have to prevent that. Um, but also it's used, that's not the only reason. And it's used because it is seen as a safety measure when students are having a crisis. So this is, I think, probably well, I would say what I've heard to be the most common uh, reason is that the student was getting activated and was being very heightened emotions. Maybe even the student knocks their desk over or throws a chair. And I've heard arguments that that is not enough to qualify as someone is going to get hurt, right? So people see it as a safety measure when there's a crisis, even if the student is not physically threatening harm or going to cause harm to an adult or another child or themselves. So that's one reason that it's seen as a preventative. It's also framed as a last resort when other responses fail. And to unpack that one a little bit is, we tried to calm the student down. We tried to, minimize harm, whatever it was, but we couldn't do it. So we had to put them in seclusion because there's nothing else we could do. And in that situation, what that is saying is, there's nothing else that can be done for students who are in crisis, right? So that's the last resort. We've hit the end of the road. Um, it's used because staff believe it can de-escalate. Uh, it kind of goes with the first one, but it's more about calming the student down, and then it is like just keeping everyone safe, I guess. And sometimes it's used because students being disruptive and people want to control the classroom or have the classroom be orderly. So basically, it's used as discipline, school discipline. And all of these reasons have been generated from research that has been done with educators and parents and students. So that's some of the reasons why, but we know that it's probably not all of them. Okay, so let's talk a little bit about what the data tells us. And now this is old, and people are going to say, oh, this is really old, 2018. Um, I'll let you guess why we don't have more recent data. Uh, but this is the most recent federal data I can find. It's the Civil Rights Data Collection. That's what CRDC stands for. And that collects data on all sorts of things in for education federally and who's impacted or who experiences certain things more, like everything from being in a gifted and talented program to suspensions to number like funding for field trips, all sorts of things, and breaks it down with demographic information like race and gender and things like that. So the 2018 CRDC showed, and this is nationally, okay, 3% of all students enrolled, oh my gosh, my number is gone, have a 504 plan. I believe it was like, I can't remember. I'm not gonna lie to you. I'll have to look up the other thing. It was more, I think it was 6% of students secluded, 6 or 7, have a 504 plan. So they're 3% of all students in the United States, or were in 2018, and more than double of that were secluded. Okay, I'll fix this before we send those slides up. 13% of all students in the United States enrolled in schools had an IEP. 77% of students who experienced seclusion in the United States had an IEP. So seclusion overwhelmingly happens to students who have disabilities or who are in special education. And in many states, it's only used for students in special education. Um, that is the policy. And then there was no racial data reported this is the highlights report where they extract the data for you. I haven't looked at the raw data except for Black students. And so in 2018, Black students made up 15% of school enrollment nationwide and 35% of students who were subjected to seclusion. And if they had an IEP, that number changes to 60%. So if you take a pie of 100%, 60% of those who were secluded, were Black students with IEPs, even though it's 15% of all enrollment. So those are some data highlights of, how does seclusion look? Now the next slide is taken from a report from the GAO, the General Account. What does GAO stand for? Accountability Office? Auditing Office? The federal office that looks at money stuff. And this is just a graphic they had in it, but they did a whole report on how poor seclusion data is. Thank you, Accountability Office. I knew that. So there is also a link to this at the end of the slides, the full report. This was done in 2020, and basically they found that there was a lot of school districts who reported zero reporting, zero seclusions, um, when actually there were seclusions. Um, and part of this is because when the CRDC is doing their reporting, they're only reporting on 30 school districts. So they pick around, I think it's random, 30 school districts, even though we have about 17,000 in the nation, and that's what they're reporting on. So the data is not super reliable nationwide, right? Um, there's an assumption that there's a lot of underreporting. The incidents are really low that are reported, um, and that the data doesn't make sense. So the last graphic there, almost 600 schools reported more student restrained or secluded than incidents, but the rule to identify those cases only applied to less than 1% of schools. So there was more students than incidents, but then that doesn't apply to all schools. So this has been an issue for a while. It's always an issue, I think, with any federal data, but specifically with the CRDC and education data. So I will present some stuff from Minnesota, the Minnesota Department of Education. So last year there was actually a working group in the legislature to look at school seclusion, and this is a report that the Department of Education presented to the state lawmakers, and there is also a link to this. And so if you want to see the full report, it's fascinating. Um, it's actually a slide deck, but this goes from 2021 to 2022 school year to 24-25 school year. And right away, we can see that children who are under 5 years old were being excluded or secluded. The law to make it so that third grade and up was supposed to be the only group that could experience seclusion passed in 2023. So 24-25, much fewer, but it's still happening. However, with the misunderstandings of defining seclusion, it's hard to say if this was truly seclusion for these young children. And then we have 6 to 10 years old, which is still less than third grade, but maybe a little bit above. So hard to tell how many. I don't believe this report broke it down by grade level, but I can look. So uh, the largest group being 11 to 15-year-olds. And we can talk about why that is or why y'all think that is. And they go up to age 22. They just say because you can be in high school up to age 22. Okay, so that's ages. And here's the racial breakdown. So white students were secluded more, or there were more incidents, or more students, I should say, secluded who are white, but this is not a proportion, so it doesn't tell us out of how many. So is it 199 white students out of 5,000 or 2,000? We don't know for any of these numbers. These are just the raw numbers of how many students experience seclusion for each of those years. Um, I'll let y'all look at that for a second because the one that actually I think is the most interesting is American Indian or Alaskan Native. Um, I look at school data a lot, and I feel like 11 is really high for that group overall. Again, I don't know. And I could go back and try to find the total population and demographics for each of these years and see the percentages. But um, often in MDE data, student American Indian and Alaska Native students are not even included because there are so few enrolled in the districts. So that's just a thing. Okay. Um, and then this is the different diagnoses. And so these are the, what did I say, 13 diagnoses that um, the IDEA Act covers. So it's two slides, this slide and the next slide. But so here I'm thinking, okay, so this is just diagnoses that are in the IDEA Act. We don't know about disability categories uh, other than that, as far as this report goes. Emotional behavior disorder is the largest group or largest diagnoses group. And I'm not going to go into a lot about that except to say that's a diagnosis where we see a lot of disparity, a lot of over diagnoses of certain races and boys more than girls and things like that. And then autism spectrum disorder, obviously being the second highest here for students who experience seclusion. And then in the next slide, it's just it's much lower numbers, physical impairment, other impairments, things like that, specific learning disability. Not sure what that means exactly. I have seen people say and read that it means ADHD, but I don't think it actually does. I think it's other disabilities, like not sure. Um, because ADHD is also covered in the 504 plan, so it's hard to say. Uh, speech and language impaired is on here, very low numbers, things like that. Okay. Any questions about this so far?
Seema, I think the only question from a little while ago was just a follow-up. This person is wondering about seclusion then if the child is not on an IEP.
Then it's illegal and it should not be happening. Yeah.
Great, thank you.
Well, unless they have a 504. But if they don't have any special education documentation, then it should not be happening at all with that student. Um, okay. So seclusion. Now, this is from partially my research and my discussions with educators, and partially what I've read and heard other people say. But I had I have had educators when I say like is I don't even know what I asked them, honestly, but I've had them state to me that if a student has a history of sexual abuse, then they would not seclude a student because you would not want to. Thank you, Stacy, for putting that in. Um, you would not want a to have them secluded because in order to seclude a student, you have to put them in a physical hold first. And that can be traumatic to them. Now, obviously, that could be traumatic to a lot of different people. But that is one where people have said we would never use seclusion for that student. And in order to ensure that doesn't happen, we would make sure all staff know that this child has a history of sexual abuse. Um, in that conversation, they did not indicate whether or not they would uh, let the student know that all staff would know that. Another one was if a student has a risk of self-harm. I'm not sure how that is defined because what research shows is that there is actually a lot of self-harm that happens in the seclusion rooms. Um, so I'm not sure what that educator was saying to me when they said that, what they meant, but I think they meant if they'd been secluded before and had harmed themselves in the seclusion room. So the other thing that I had heard and have seen in other documentation is that if a student can't be, for one of these reasons, put in seclusion, then what you would do is call the police on the student and have them arrested, or have the police intervene, I guess. So that is the often the only alternative that educators know about. I'm not going to say would use because I think there's many alternatives that are out there that educators don't have the resources to do or aren't allowed to do or aren't trained to do. But that's kind of that part of it. Um, Sorry, my computer just, my mouse decided to go on vacation. Okay. Um, so then what happens when a student is secluded? All right. Or not just students, sorry. What are the impacts of seclusion? So trauma can definitely be exacerbated. Mental health distress, right? Being put in seclusion can be very traumatic and hard for a student, for a young child, for an older child. They can be physically harmed, either during the process of being taken to a seclusion room or with while they're in it. Relationships with adults, right, can be damaged, and not sure, how that looks in an ongoing situation where a student then goes back into the classroom. That can, um, I heard some teachers or educators talk about that situation. Um, there is some work done that says that other children in the class are also traumatized and experience high stress when a student who is not them, is secluded. And the secondary trauma for staff and educators is a very real thing. The report that I was showing some data from, that same report also shows that total in those years, I think it was 21 to 25, there were 193 staff injuries reported um, during a seclusion process, and 209 student injuries were reported in those 4 years. Um, See if there was anything else I wanted to talk about. Nope. Okay. So benefits, there is none that we know of. Um, the GAO also did a study in, I think, 2016, an older study, where they did a cost benefit analysis to see what were the benefits of seclusion. Was it saving money? Was it a positive thing for school districts to do? And they found that there was no known benefits, that seclusion is not shown to prevent future incidents. It's not shown to de-escalate students, even though there is a belief that it does de-escalate. It's not shown to improve behavior. It is not a behavioral intervention. So we don't actually have evidence of benefits. We can't say that it prevents harm because we don't know if that harm would have happened. Um, and then the impacts on families. So the Brookings Institute released a report where they had talked to parents and families and found that actually family members also experienced mental health issues because of a child in their family being secluded. And uh, I think his name is Charles Bell, has done a lot of research around uh, Black families and uh, school discipline as well as seclusion. And he has found that families face social as well as financial costs when they challenge school authority in general. So anytime they say, no, we don't want that for our child, is what that means there. And there's a lot of burden, mental as well as financial burden, uh, to parents and families to push back against restraint in seclusion. And that burden is uneven, right? he did another study with some other folks where he talked to parents of Black and white children with disabilities and saw that they experience those costs differently, but they both do experience the cost of challenging seclusion and restraint. And, talked about how it's also a racial justice issue. And then a couple other studies have come out. One, Amos, uh, showed that relationships with schools can become really adversarial. And when seclusion is used, there's not really there's a lot of damage that can be done between a family and school staff. And so they emphasize prevention and talking about alternatives and ensuring that there's alternatives in place before a seclusion happens. So that's some of that research. And then um, for the impact on schools, we talked about staff being injured a bit and experiencing secondary trauma, but also primary trauma is a thing. I had many educators talk to me about severe injuries that they had had themselves or witnessed firsthand, like bones being broken, traumatic brain injuries, things like that. Um, it can increase hypervigilance as part of, the trauma and things like that, and make educators more likely to rely on coercive responses or more reactive. Um, Schools, in general, they're going to have higher costs, work, injury, litigation costs, um, either from families, uh, if a child is injured or inappropriately secluded, like they don't have an IEP or whatever, or from staff, right, who are injured and maybe need to take workman comp or maybe even litigate. Um, it can reduce instructional time. That one's not a shocker. So students are gonna fall behind, perhaps, if they're experiencing seclusion. And not just the student who's secluded, but it will destabilize everything that's going on in the classroom usually. So that instructional time is lost for many students. And also, there is a study that says that schools who ban seclusion or that ban seclusion, um, in those schools, teachers report higher job satisfaction and they stay in their jobs longer. Okay, I think there is at least one question.
There was a question in the chat about the slides being shared, and we confirm that we will send out the slides. There is an attendee raising their hand, and I'm not able to open that up right now, but if there's a question that they can put in the Q&A, that would be great.
Sure, we'll give it a second just in case.
Seema, do you have time to take this question from Teresa live?
Sure, I think so. We're basically
Okay,
right on time,
let
so
me see if I can.
I think I might be able to do it. It's just
And
might
then,
take me.
okay, great.
You.
Teresa, are you able to talk? Let me see. Allow to talk. Okay. Teresa, would you mind verbally sharing your question?
There we go. Can you hear me?
Yeah.
Yep.
Okay. So I guess one of my questions is youth with disabilities in particular, or youth with 504 plans or mental health. Um, if they, if there's any correlation between youth in foster care and youth in or experiencing seclusion in school. Um, and because anecdotally in my just lived experience, both as a caseworker and now as a licenser, that seems to happen, but I probably have a bad attitude. So
Thank you, Teresa, for bringing that up. That is a great question. Oh, it's a question I'd love to be able to answer. We don't have that data. No one has done that research, as far as I know. And I've looked. And so this is actually part of why I'm doing this presentation is because this isn't something I want to research myself and find out more about. So maybe you and I can talk at some point, because we don't know what the overlap is, data wise, right? You have your experience with that. And so we can guess that there probably is quite a high overlap, but we don't actually know. And as far as I know, the schools don't collect that information. And if they do, I've never seen it reported anywhere. Um, so unfortunately, we don't have good data about that. I will look more. There might be some studies that are older that are like qualitative about people's experiences in foster care and being secluded, or child welfare workers' experiences with that, but nothing that actually tells us that there is an actual correlation or overlap yet. We'll see if we can get something going. Um, okay. Is there any more questions?
Not that I'm seeing for now.
Okay. So yeah, we'll go into like, what do you do if you're a caseworker? So, um, sorry, again, driving this computer. Uh, most of y'all who work in child protection probably already know this, but just in case, want to make sure it's clear that if there's a 504 or IEP meeting, as a child's caseworker, you should be invited to that meeting. I mean, as long as the family and the child wants you there, you can attend and you can advocate for the family and for the child. Um, and those meetings are really important because that is where they're making the decisions based on, the child's needs and the family's perspective. Um, and so caseworkers can provide information about child's, current, how they're doing, their care history and service needs. Obviously in consultation with the family and with the child. But that's one thing you can do is be there to make sure that that information is clear and is communicated clearly to the school. Um, if before a seclusion, right? Here are some things that are important to remember. Like I said early in the presentation, look up the restrictive procedures plan and talk to the family and the child about that. Okay, your child has an IEP. Here are the things that could happen, right? Here's the plan that the district has laid out for how those things are supposed to happen. Um, Preparing families for an IEP meeting. Probably already do this. But right, just explaining what the meeting is, what it's for, ensuring some understanding there, hopefully participation as well. Bringing the child's voice into the planning, even if they're too young or maybe not mentally capable or cognitively capable of participating, still trying to advocate for what that child would, is comfortable with. Maybe that one way they calm down is to, I don't know, have a certain food or to, watch a certain TV show. You can bring that in, whatever it is. Um, Requesting a functional behavior assessment and a positive behavior intervention plan. This should happen before there's a seclusion. It often, usually happens after. Um, Not always, but what I have found in Minnesota is some schools will do it every time there's a seclusion, and others will not. So to request that this happens before there's a seclusion incident, and make sure that that is part of the IEP, right? That this intervention plan is already in place. And writing in those proactive supports. So, like, I talked about. Maybe it's going on a walk with a certain peer or an adult that they trust. Maybe whatever it is that can help them regulate their behavior and that can help with intervening in a potential crisis or harm situation. And then providing that history and context so that the team at the school really understands the student and their needs. Um, yeah, so those are some things. And then after a seclusion, there we go. Um, so a school will document and debrief for themselves. This is without the parent or the child. It is with their own internal documentation and debrief. I believe that this is part of the policy and the law that they have to do this when there's been a seclusion. Um, they have to notify the parents the same day. And then, as I mentioned earlier, if there's been two seclusion incidents within 30 days for a child, there needs to be a new IEP meeting. Um, Sometimes, or I should say, maybe even more than sometimes, students are referred for additional services. And this is, again, what I was talking about earlier was the importance of the medical diagnosis or the non-school diagnosis. Um, but what I've also heard is, as I'm sure y'all are all aware, there are very long waits for services. And it's really difficult to get a child the services they need. In order to manage or themselves and not have additional crisis situations. But that's generally what happens. Um, there's really no data or standard for how schools monitor patterns of seclusion. So it could be just that classroom teacher knows that this kid has experienced, I don't know, like 6 seclusions in 8 months or something. But as far as what's happening in a school, is it, students in a specific class or in a specific grade or with a specific diagnosis? That is not known and that is not required to be collected. Okay. So after seclusion, first thing I would say is approach that situation as the plan that was in place is not the right plan. So even if the school, if it's one seclusion and there's no legal requirement to have an IEP meeting, push for an IEP meeting, right? Um, or at least a new behavior intervention plan. Um, because whatever was in place before clearly did not work. Meet with the child. I think this one is really important. And one thing that I observed when I was talking to educators was that that doesn't happen, or that wasn't something they spoke about happening, is actually talking to the student after the seclusion to debrief. And maybe it does, and they just didn't tell me, but I think, as the child protection worker, definitely you want to talk about that with the child. Talking to the caregiver slash family. So, reviewing what happened, making sure that they have the information you have and vice versa. Um, Document what the school says and anyone else. So if the child gives you their version, clearly you want to put that in your case notes as well as the school's version, family, etc. I already said request a new assessment and do what you can to monitor the service referrals. You might collaborate, make your own referrals, things like that. Um, so there are things that can be done that are not seclusion. Certain de-escalation trainings or techniques that have been developed specifically to prevent seclusion do exist. Some schools use them and have the money to have their staff trained and things like that. Some schools don't. And, there's a lot of different issues. When staff do get trained, then of course there's turnover, things like that. And they're not always 100%. Just because a school is using these techniques doesn't mean that seclusion isn't going to be used at all anymore. relationship building with students can be a big one, right? Getting to know the students, the adults in the building, really understanding the students' triggers, what helps them manage and calm their behavior, all of that. So positive behavior interventions and supports, PBIS, has been shown to be a big, uh, I don't know how to say it, intervention to seclusion. And PBIS, I have my own criticisms of, but it's really come a long way from being this cookie cutter intervention to where now it is very customizable. And the positive behavioral supports is the really important part, right? Like, what can a classroom teacher do, or a grade or a school do to rely on seclusion less and have other supports put in place that aren't just used in a crisis situation, but are part of the day-to-day learning environment, right? And there has been the Department of Education did a study that said PBIS does decrease adverse techniques such as restraints and seclusion. Okay, and then trauma-informed approaches. Uh, I probably don't need to explain what that is. Um, Mental health supports being put in place, easier said than done. Again, funding, staffing, big issues, and communication. So this one, I think, is one that we don't talk about a lot, uh, or at least I don't hear about a lot, I should say, which is, expecting a young person to be able to say, I think I'm going to be upset, right, is maybe not the most realistic way to address possible escalation in with a young person. So having different ways or types of communication supports in place before that happens. So maybe it's, you can throw something, like you throw this squishy thing, whatever it is, uh, for the student, so that we can address the issue before it happens. Um, so when a seclusion happens, you can also report it. And like I mentioned earlier, the Minnesota Disability Law Center, which is part of legal aid, is the statewide kind of auditing organization that oversees seclusions in the state. And so they will take reports. Um, why reporting matters. I think we're going to get into that part in a minute. And it creates a record and helps. Remember, I said like there's no patterns identified by the school or by the MDE, but it can be identified with external reporting. And Pacer Center is another organization in the state that advocates for families, and they work closely with Disability Law Center. So there's their phone number and their website, and you can report online at that link, or you can give them a call and put in a report and let them know when there's been a seclusion. So you're going to want to report when seclusion is used outside of law or policy, which now you have a better idea of what that is. Um, it's really supposed to be only in emergencies. When there's a If a school doesn't have a restrictive procedures plan, you would want to report that. And um, anytime restrictive procedures is used that you know about. Um, if it's repeated use, if there's an injury, if the documentation's not happening, you think it's being misused, all of those things. It must be a true emergency response. I have heard people say that it has to be life-threatening, that level of an emergency response. Um, that's not what the law says in Minnesota, but I think in some places it does say something to that effect. So the next slide Actually, forget all that. Just report it every time. You don't need to sit around and think, oh, was this actually, up to par, blah, blah, blah. Just report it. Reporting will help, if there was no issues and it was all done appropriately and, I don't want to use the word legitimate, but following the rules, um, then there's no harm in doing the report. What it does is it allows MDLC to know where seclusion is happening in the state. End of story. Um, if there were issues, then MDLC can follow up on that. And generally, my understanding is they will contact the family. They'll probably work with you, if you're the caseworker, about what the family wants to do. Do they want to litigate? Do they want to, do other things? I'm not sure what all the legal options are. Okay. Um, so yeah, report every seclusion incident. And then, okay, here's all the reasons why it's important, which I already went over. Um, it makes it visible. That's the most important part, And the more visible seclusion is, the more people will know what it is. Hopefully, the more it will be um, looked at as something that needs oversight and critique, and to see if it has being done in a way that harms students and adults or not. So the steps to that, obviously you want to obtain permission from the child caregivers or assist them in doing the reporting themselves. Let the MDLC or whoever you're talking to, if it's PACE or center, know that it's a seclusion concern, um, and whether or not the student has a disability per the school. And clear, obviously, caseworkers know to do this. You want to give details like the school name, what happened, how long they were secluded, if you know that, any injuries, things like that. Another thing is to stay current. Laws may be changing anytime. Last year, there was a proposal, last year and the year before, to expand the use of seclusion in Minnesota. There were many different versions that I heard, including making it so that students who are, it's not just students in special education, but all students, and also lifting the ban on seclusion for students third grade and below. And part of this was also to make it so that parents had to give permission in advance through the IEP meeting, for before seclusion can happen. And that could, cause a lot of different problems with parents not understanding what seclusion is or what they're giving permission for, or maybe, often in my experience, parents at IEP meetings don't understand most of what's happening in the meeting. So, there's often issues with language translation issues, all sorts of things. So that was the proposal. It hasn't gone anywhere as of yet, but it could change. Or it could change to be that seclusion is used less. For a long time, I think in 2014, the state recommended that seclusion be sunsetted in Minnesota, and it is something that is part of MDE's recommendations, and that has not changed. But looking at district restrictive procedure plans, also, those can be updated or changed. So making sure you have the latest copy of that. Obviously, knowing what mandated reporting duties you have around seclusion. If a child is harmed in a school setting, what does that look like? Things like that. And then, okay, legal aid and MDLC are the same thing. So I should not have put that. But, and also PACER Center. Again, there's links to all these at the end. And then, just in conclusion, just know that, like I said in the beginning, seclusion, well, I didn't say this, it's not just a school issue, right? It's about safety, it's about mental health, disability rights, and partnering with families, I should have said, and also children. And as a child welfare worker, you can advocate for families, document, and, and push for supports that really are safer for children than seclusion. So. That's it. That's the whole deal.
Great, thank you, Seema. We just had a couple questions. We're back to the 30 school days or 30 total days, and Robert clarified that it's 30 total.
Yep.
Okay, Robert might be a good partner. He seems to know a lot here.
Yeah.
Thank you so much. And then Teresa, you can also look, but Teresa had another follow-up question. If the youth is on an IEP or 504, wouldn't this documentation be included in the HIPAA and data privacy laws governing these designations?
I'm not sure, but oh, is it a question asking if 504s and IEPs are fall under HIPAA? I don't believe so because they're not medical. They would fall under FERPA. But if the family gives you a copy, invites you to the meeting, or if, I mean, how I got IEPs often was from the attorney in the case, then there's not an issue with having them. But I'm not sure if that was the question, if I'm answering the right thing.
Teresa, if you, let's see. Okay, Teresa says thank you. So I
Hi,
think,
sorry.
okay, go ahead. Yeah.
Yeah.
I was
Did
I
that make
was
sense?
referring to, and thank you for correcting, it's not HIPAA, it's FERPA. But
Oh,
what I was referring to was that narrative that is not always released, the internal narrative that's documented. Any documentation that is part of a child's treatment is considered part of their file, right?
mhm.
I think about in any other setting, why wouldn't that narrative that's being documented in the school be part of that child's file and be available to their guardians
Good
under data
question. So,
privacy?
yeah, you're talking about like the debrief part, right?
Right.
That I
Yeah.
mentioned. Yeah. So, my understanding is that part, whatever is documented related to that, isn't, they don't include the child's name. They are documenting for reporting to the Department of Education. So, it's the documenting that's, well, one, part of the employees, like, I would assume like kind of supervision, like debrief, like how could we have done this better or what went wrong and things like that. And two, to get the information they need to report that seclusion to the state because that all seclusions are supposed to be reported. So it's has to do with the child, but it's reported in a way that is anonymous, that is just about the school's use of the exclusion more than what happened to the child. I hope that makes sense.
Teresa, just follow up if you have any other questions on that.
Yeah.
And then we'll move. It looks like we have a little bit of time here. Josephine has their hand raised, so let me figure out how to get to you, Josephine. One moment.
No, it's
Okay, go ahead.
Can you hear me?
yes.
Okay, perfect. I just wanted to add that the goal of the briefing is really not for the child. It's really an opportunity for the team to assess what is it that they did that was right and what is it that they might have been a misstep and how can they correct that misstep for other children going forward. So it's really not for the child. It's really an opportunity, like some kind of an internal improvement within the team.
Yep. Yes. Thank you, Josephine. That's exactly how I understood that. Yeah.
Okay, well, we'll give it one more minute for questions. Feel free to put them in the Q&A if anybody has any follow-ups. And then we'll make sure that Seema's information is in the chat. And we will send out the slides as well as the resources as well.
Yeah. Yeah. And, if folks are interested in talking more about this, I would definitely love to continue the conversation. Um, So please reach out and let me know. Um,
Okay. Do you want to wait or wrap it up, Dr. Samima?
Samima.
Samimi. Sima
You're not the
Samimi.
a lot of people call me that, actually.
I know.
I think if people are good and, you can send me an email if you have questions. Otherwise, I'll give you the last couple minutes back.
Thank you so much for your work in this area and for the translation to child welfare research and practice. I do think a lot of folks are really engaged on this issue, and I know the Ombuds Office for Foster Youth would be interested as well. And so it was fun to try to connect. And please reach out to either Cashew or Seema if you have any further questions or want to collaborate. We really appreciate your time, and thank you again.
Yeah. And thanks for all the great questions.
All right. Have a great afternoon.